Our next presenter is Portia O'Connell, and she did her practicum with the Montana Public Health Training Center and the School of Public Health, I suppose. Her site mentor is Dr. Carrie Harris, and Portia did her practicum on the salary study for public health professionals. So take it away, Portia.
Thank you, Lee, for that introduction, and I'm just going to share my screen and pull up my presentation. Okay, so as Lee mentioned, I'm going to talk about my APE experience, which was on the salary study for public health professionals. During this quick presentation, I'm just going to briefly explain the purpose of the study, describe some of our methodology, report a little bit of our collected data, and then address the competencies and deliverables that I did. First, I just want to shout out the project team that I've worked with. I've had the pleasure of working with Alexis Shamir, who is a first-year MPH CHIPS candidate, and then also being mentored by both Lee Taggart and Dr. Carrie Harris throughout these last 11 months that I've been a part of this study. So the purpose of our salary study was to investigate and report salary levels for public health employment categories at local and tribal health departments in Montana, with the ultimate goal of providing local and tribal public health leaders with a data-driven report that could better inform salary decisions and promote successful recruitment and retention efforts for Montana's public health workforce. And then the funding for this study was provided by the Montana Department of Public Health and Human Services. So just a brief timeline. Through June to September, our research team met bi-weekly, and our guiding documents and methodology were identified. In October, our data collection tool was created and our strategies for data collection were clarified. And then on November 15th, our initial outreach to health departments began via email. And then from November to February, we followed up with additional emails and by phone call if needed. And then on March 1st, our data collection ended, and we have just kind of wrapped up our data analysis and are working on our final written report right now. So our methodology included identifying a list of the top public health job titles, which included a public health director, a public health program manager, a registered nurse, community health worker, and health education specialist, along with a sanitarian and a few other public health titles. We then broke down all of the counties into 5 population densities, which included frontier, small, medium, large, and tribal. And once we were ready to begin our data collection efforts, we contacted all local and tribal health departments through email. And again, as I mentioned, followed up through additional email, phone calls, and personal communications. And then once we started to receive that salary information back, we started to classify the health department job titles using the 2018 occupational classification codes that come from that Occupational Employment and Wage Statistics Survey. So just a brief layout of just our general data that was collected. We received salary information for 32 county health departments, 9 of which were frontier, 7 being small, and then 8 being medium and large. Of the salary information that was provided, we received 521 public health salaries, which we broke down across 31 occupational classifications. So this slide just highlights the foundational and concentration specific competencies that I worked on throughout my APE. And over these next couple of slides, I'm going to break down each deliverable that I did and what competency was met with those deliverables. Deliverable 1 consisted of a standardized occupational classification code document. As I mentioned in the beginning part of our methodology, we highlighted some of the top public health jobs that we thought we would see throughout the counties that we reached out to, and went to that OEWS survey to find that 2018 occupational classification code. And then as we continued to receive our salary information and get some health department titles, we continued to go back to that OEWS survey because there are quite a few different health department titles that we had to classify and go through that document and make sure that we were classifying it with the correct occupational code. So this image that I included is just a brief example of 2 SOC titles that we had, and then their SOC number, and some of the health department titles that were associated with each one and were classified under that code. My next deliverable included inputting our salary data from our data collection form onto an Excel spreadsheet. Of the 32 counties that we received information for, I was responsible for inputting the data for half of them. So this image that I included is our initial data collection form that we sent out over email. And then over the course of November to February, I had to continue to reach out through follow-up emails and phone calls because we had begun our data collection efforts right before the holidays had begun, and there were also different surveys that were going on. So there were some health department leaders that thought they had filled out this survey when really they had filled out another workforce assessment survey, or they just got caught up with the holidays. So once we had come back from Christmas and New Year's, I had followed up with email and then also phone call for missing data, or just to see if they got this email and had filled it out and sent it back. Similar with Allie, I also presented at the Confluence conference on April 3rd in Billings. And so I just included an image of my first slide that I did, and that was just the preliminary findings that we had. And I did a 15-minute breakout session, and I believe I presented in front of roughly 100 public health professionals that had attended that conference and my presentation specifically. My last deliverable that I have was the creation of pivot tables for each SOC code. So as I mentioned, we had classified 521 public health salaries across 31 SOC codes. So there is a pivot table for each of those SOC codes. This is just an example of one, our community health workers. So we broke down the pivot tables by including the county and then finding their average for the average pay for each of the counties, and then the count for how many community health workers were in each county. And then we have the total down here, which I just realized my thingy is kind of in the way. So can you guys see the count? I hope so. Okay. So there was 49 total community health workers. And then we have this weighted average down here for their salary. And yeah, so this is just one of the SOC codes that I did that for, and I had done that for the 30 other SOC codes that we identified. That's all I have prepared for you today. I just want to thank Lee and Dr. Harris for their mentorship throughout this past year, and for Blakely, I don't think she's on, but just sticking with me when I was coming out to Montana and making sure I found my way out here to be a part of this program. So thank you.
Thanks, Portia. Great job.